Bit Kids of Southwest Oklahoma wants children and families to stay healthy and safe this summer. Today's summer health tip covers the ins and outs of insect bites in the Southwest Oklahoma area.
So I'm Dr. Ed Legayco, and I'm a pediatrician. I've been in private practice for 31 years, board certified by the American Academy of Pediatrics. And one of the more common things that mothers get concerned about are bites to their children. And this time of the year, we certainly see our share of bites. Most moms get concerned because there are poisonous bites, and so they want to know, number one, is my child's bite something to really be concerned about? So what I do is I try to talk to parents about what I call the Bite 101 lecture, which we talk about the difference between a more serious bite and something that's a very common bite.
What are the dangerous bites your child can receive in Southwest Oklahoma?
In Oklahoma, we essentially only have two true poisonous, what we'd call poisonous bites, and they're both from spiders. One is a brown recluse and one is a black widow spider. All other bites are not poisonous, but certainly each child reacts differently to bites. For example, the most common bite we see, mosquito bites. Mosquito bites, one child may get a very tiny red area and another child may get a very large red area.
When should parents worry about the severity of an insect bite?
So how do you tell if your child's bite is something to be more concerned about? The poisonous bites react differently. They're much more painful, but the center bite area where the insect actually bit your child, that center area will turn black or dark. Anytime you look at a bite and it's red, red means there's good blood flow to the area. Red and warm is not necessarily a sign of danger. So when mothers look at a bite and they see that it's red and large and warm, they naturally think infection, and that's not necessarily true. The bites we get concerned about are bites that are not red but are black or dark. A fiddleback spider and a black widow will generally cause a dark area at the area of the bite. They can be much more painful, and these can be very dangerous because they can not only cause tissue loss, but in some cases they can cause full body reactions where it affects the different organ systems in the body, whereas things like mosquito bites and ant bites generally don't.
How are insect bites treated?
So when I look at a bite, if I see that the bite area is red, no matter how large it is, I know it's probably not a more dangerous bite. And I'll treat those with treating symptoms. If the child's itching, I can give them over-the-counter Benadryl, which the dose is according to their age, and on the package insert. I use over-the-counter cortisone, things like cortisone 10, Cordaid, which help cut down on the itching of the bite, and you're basically treating symptoms. Now, if a child gets one of those bites around the eye where it may swell the eye shut, we can give steroid injections which very quickly make the swelling go down. But generally, most all bites are going to get better no matter what you do. So you're trying to make your child comfortable with those type of bites. Whereas if we think it's a more serious bite, like a fiddleback bite or a black widow, we might prescribe steroids, we might prescribe antibiotics, depending on what the bite is. And in those situations, if you think the center bite area is looking very dark, not red, then we will want the child to come in to be checked, whether it's at the office or whether it's the emergency room.
Should parents be concerned about fire ants in Southwest Oklahoma?
Another thing that gets a lot of press around here is fire ants. Fire ants are a distinctive type of ant that, even though they're not poisonous, they produce a much different reaction. When you get bit by a fire ant produces a blister that turns into a pustule that, even though it looks like an infection, it's not really an infection. And that can last 3 to 4 weeks before it gets better. And there is really no known treatment. The good news is most of the ants that we see are not fire ants. They're regular, either small red ants or larger red ants or black ants, and they'll produce some pain and they'll produce some swelling, but they won't produce what fire ants do. Fire ants are more common in Texas and farther south toward Mexico. So we don't commonly see fire ant bites. Most of the fire ant bites I see as a physician are children who have been in Texas who have been bitten by them. So we almost don't see those much in Oklahoma.
Is there anything else parents should know or keep in mind about insect bites?
So bites are something that may make your child irritable or uncomfortable, but most of the time they're not bites by insects that are very dangerous. Another thing to remember about the dangerous bites, a fiddleback is not an outside spider. So if your child gets bit outside, they're generally not getting bit by a fiddleback. They're almost always indoor bites. Now, that's true somewhat of black widow spiders, but they like cold, dark places. So if they're playing in the grass, you're not going to probably find those outside in the grass. They're going to be inside barns, inside garages, or places where they can hide.
This has been a summer health tip brought to you by Fit Kids of Southwest Oklahoma. For more information about Fit Kids, visit our webpage or like us on Facebook for daily health tips, news, and events in the Southwest Oklahoma area.